swelling, headache or a rash, asthma, colitis, fatigue, or gas. What will today's symptom be? My loopy life with lupus. Hi guys, so today is May the 24th, day 24 of Lupus Awareness Month, and it is also my 5-year wedding anniversary with Alex. I'm going to be posting a montage of our wedding day in honor of our wedding anniversary, so I hope you guys will enjoy that. Also, following this video, I will be doing a quick little video to draw the winner of our giveaway and announce the winner, so stay tuned for that video. But in this video, I just wanted to quickly discuss just how many doctors do I have. Because the thing is that when you have lupus, you generally end up with quite a few doctors on your list. So I'm just going to quickly go through those and explain why I see them. So first and foremost, I see a rheumatologist, and the rheumatologist is like the main doctor to deal with all things lupus. And generally what happens is, depending on what lupus is affecting, then they will refer you to a specialist that deals with that area as well. So I, along with the rheumatologist, the other doctors that I have are obviously my primary care doctor. You know, he's my family doctor. And then I also have my thyroid doctor, who is, well, his actual, term is endocrinologist. And so he looks after my hypothyroidism. I also see a cardiologist who looks after my regular heartbeat. I see a GI doctor who takes care of the colitis issues, but I haven't seen him since about September, I guess, because everything in the colitis area has actually been calm. I'm not on any medication for it anymore. So unless it comes back, I probably won't be seeing him again. I don't really need to until things flare up or whatever. I see a respirologist because I have a mild case of asthma, although that's been pretty good for, gosh, almost a year, I think. It's actually been really good. I have an inhaler to use like as needed, but I really haven't had to use it very much at all. And so I am seeing my respirologist, I think it's this month actually, in a couple of weeks. Yeah, I'll be having a breathing test and just a follow-up, and I'm hoping that I won't need to continue seeing him. Like, I hope the breathing test will show improvements since the last one, and I'm going to tell him that I really don't use the inhaler. My shortness of breath has improved a great deal. I really don't have it at all. So hopefully that'll be another doctor to drop. I'm trying to think. I also see a gynecologist. She watches, she just basically deals with my birth control and the, regular exams and all that stuff. It's hard to keep track of them all in your mind. I don't know, like, I'm trying to think of all the medications I'm on and who prescribed them. You gotta laugh about it sometimes. You just gotta laugh about it because it's like, oh, let's add another doctor to the list. I was seeing a nephrologist at the beginning of my diagnosis, which is a kidney specialist, because my kidneys were being affected a little bit at the beginning, but since that's been stable, I pretty much don't have to go back to her unless my kidneys start to act up again, which fingers crossed. Hopefully that doesn't happen again. Yeah. Oh, and I'm also seeing the, I can never pronounce it properly. It's like myofascial surgeon or something like that. Basically a special kind of dentist that's keeping an eye on my jaw joints because I had some arthritic problems in there, and we're keeping an eye on that because my jaw joints have pretty much deteriorated to the point that if they ever needed to do jaw surgery again to correct my bite, they would have to give me artificial jaw joints. So he's just basically monitoring every, I think, 3 to 6 months. We're doing x-rays and whatnot on my jaw just to monitor it. And also, like, if my pain levels start to go a little bit too crazy, then we have to start looking into treatments for it or whatnot. So I see that doctor. And I should have wrote all of them down before I did this video because it's hard to remember them all. It's like, man, like you just constantly have doctor's appointments. It's crazy. But I usually have like anywhere from like 1 to 3 doctor's appointments a month, which is actually an improvement because at the beginning it seemed like I had an appointment like every week. Let's see. I'm going to go into my phone contact list just to kind of jog my memory here a bit. So we have, I have a feeling I've covered it all. Yeah, it's looking like it. Looking like it. Oh, yes. Ophthalmologist. I see an ophthalmologist. He basically keeps an eye on my eyes because when you're on the drug Plaquenil, it can actually cause macular degeneration in your eyes. And so every 6 months, I see my ophthalmologist for simple little exams. But once a year, I see the ophthalmologist who does like a visual field test and like all these in-depth looks at my eye just to make sure that the Plaquenil is not affecting them at all. And so far, so good. I mean, we're going on, I'm trying to think, I was diagnosed in 2010, 4 years. So we're going into, well, we're just getting into the 4th year of being diagnosed, and so 4 years on Plaquenil, and there hasn't been any issues with my eyes being affected. I've had glasses since I was in grade 10, so that's nothing new. And that's pretty much it. So those are all the doctors that I have, and what they're for. And as I said, like basically the way it works with lupus is that, you know, if all of a sudden lupus started to attack my, you know, neurological system, then my nervous system or whatever, I would be sent to a neurologist. You know, if it starts attacking your lungs, you're sent to a respirologist. If it attacks your heart, you're sent to a cardiologist and things like that. So your rheumatologist is the main doctor, but they will they will send you to specialists that deal with those specific things. Like for example, another thing would be like if I started to get a lupus rash, they would send me to a dermatologist. So that's pretty much how it works. And those are all the doctors I see. I think I used to have a lot more on the list, and they've slowly diminished. I hope that keeps going down. So yeah, so anyways guys, that's it for this video. I hope you enjoyed it, and don't forget to subscribe if you're new, and we will see you in the next video, which will be announcing the winners or winner of the giveaway. So stay tuned for that, guys. Bye.